Okay, Raphael, you tell us this is these are the co-pays, but I've also heard that patients go bankrupt. And the answer is yes. People who have a cancer diagnosis are more likely to go bankrupt. There is one study by Dr. Scott Ramsey from Washington State that looked at the risk of bankruptcy after a cancer diagnosis, and the gist of it was that it doubles. It goes in his study from zero point 0.7 to 1.7. So the number is very, very small. But there is a very, very important catch to all of this. Number one is there's no single study that I'm aware of that has ever been published that directly links the copay challenge for patients with the bankruptcy. Having a cancer diagnosis is a major financial burden in many ways. In addition to the payment for these drugs, again in myeloma, if you're getting lenalidomide, usually less than $100, you have doctor bills, you have hospital bills, you have to travel sometimes, lodging, gas, that's all quite expensive. Perhaps as important, if not more, the patient and frequently the caregiver have to stop working. So there is no income that's coming to the house. And also many of those households have, already a very limited resources. So they're in a fragile environment. So the patients are really challenged by a cancer diagnosis, but not to the extent that you would normally see again through the usual lay press. A study by the Fraser Institute looked at the Canadian patients and using the same criteria that was being applied for American patients. They find out that the rate of medically induced bankruptcy is similar in both countries. So in fact, it really highlights how many of these other factors come into play, and it's not exclusively the copays associated with these medications. Now, more recently, a New England Journal of Medicine paper, which was published just this year, had in the title "The Myth of Medical Bankruptcy." The word myth was there because the title argues that, in the content, of course, of the article, that the effects of medical expenses have been grossly exaggerated. This is something that you've seen in the rhetoric, including the rhetoric that led to the passage of the Affordable Care Act. One of those papers includes a co-author, which was Senator Warren. But the reality is that the authors now estimate that only about 4% of bankruptcies are directly related to medical expenses. So this is quite different from what we normally hear.